Dr. Salit. Dr. Salit is Professor of Medicine at the University of Toronto. He is a Fellow of the Royal College of Physicians and Surgeons of Canada and a specialist in internal medicine and infectious diseases. He's also the director of the Immunodeficiency HIV clinic at the Toronto General Hospital. His research interests include the human papillomavirus, HPV, and screening tests for HPV-associated anal cancer. He has completed a large research screening study for the detection of anal dysplasia and an assessment of transmission between partners. His current studies include community-based screening for anal cancer and the role of HPV vaccine in high-risk men. I just wanted to add something quickly before we introduce Dr. Salit, that there will be translation going on. Tim will raise his hand if it's going too fast. He needs us to slow down. All right, so everyone, give us a warm welcome for Dr. Salit.
Thank you very much. I hate to ruin the evening by talking about anal cancer. You all came out for the meal. And just remember, in 4 hours, weed will be legal. I know you guys haven't tried it, but as of midnight, you can. Okay, so I'm going to talk about anal cancer. And I'll tell you some of the reasons why this subject is important. So, do I change or? Okay. There we go. That's me on the right. On one of my trips to Russia. Okay, so this is what I'm going to talk about tonight. We'll talk about the cancer that occurs in HIV. We talked about human papillomavirus, HPV, anal cancer, and how do we prevent anal cancer. And hopefully you'll find out why I'm really talking about anal cancer. Next. So, first question, what's the #1 cause of death in Canada? I heard cancer, I heard cancer. This group is too smart. I tell you, most of the doctors, like the residents, they say it's cardiovascular disease. But you are correct. Cancer is now the leading cause of death in Canada and Western Europe and the United States. In developing countries, it's not the case. And it's infections and cardiovascular disease. So, the next question is, what do people with HIV die of these days? Hopefully it's just old age, and that's probably the case, as you see. So as you see, we had the peak in deaths in the early 1990s. Terrible time. And look how the deaths have fallen off. This is our own clinic population. So it's unusual that people will die of infection. These days, it's usually things like cancer and, quote, old age. Next. This gives you an idea of what we see in the HIV clinic at Toronto General. We have over 1,500 patients, and more than half the patients are over age 50. So a few decades ago, that was pretty unusual. But as you see, we have a lot of patients in their 60s and 70s who are doing extremely well. What's shown here is the life expectancy in HIV these days. So there's a 20-year-old guy who starts on therapy today. What is his life expectancy? Well, it's virtually normal. And that's what's shown here in red, the increase in life expectancy over the years. And you can see it's reaching almost to the general population, which is the blue. This is a study from Switzerland, but basically the same thing. So it's quite a story. Okay, so now I'll talk about cancer and HIV, because cancer is very important in HIV, just as it is in the general population. So cancer is now the leading cause of death in HIV. In the old days, of course, it was infections, pneumocystis. There were some cancers. There were special cancers that were linked to AIDS. But now, the cancers that people are getting are not AIDS-related cancers. They're not things like Kaposi sarcoma or certain kinds of lymphomas. But they're be listed here. So the risk of cancer is higher in HIV than in the general population. So that remains true, even though you have a good CD4 count and a viral load and you're feeling like $1 million. Cancer is still important in HIV. And the proportion of deaths attributed to malignancy is increasing. Smoking is a primary risk factor in a number of HIV-related cancers, especially lung cancer, but other cancers as well. So cervical cancer, anal cancer, oropharyngeal cancer, and lung cancer are all smoking related. So these are the main cancers that we see in HIV. Lung cancer has become a very important cancer in HIV. A lot of it is not really related to the HIV itself, but obviously the smoking. Anal cancer is just about the commonest cancer that we see now, however, and that's one reason I'm going to talk about it. Lymphoma is another common cancer, and liver cancer, especially related to hepatitis C, but that's a curable condition now. So let's talk about HPV. So you know HPV is a human papillomavirus. It's one of the commonest viruses in the world. Sexually transmitted, very easily sexually transmitted. So anybody who has sex picks up HPV. Extremely common. Most people, they get rid of their own HPV, so it may disappear. If you have HIV, it tends not to disappear at all. So as far as HPV, sexually transmitted, there are many different types of HPV. So some types don't really cause any serious problems. Other types of HPV do cause cancer. There's a couple of types to keep in mind. One is HPV 16 and the other is HPV 18. These are big cancer producers, especially HPV 16. That's the baddie. So if you're having sex, picking up HPV, nothing really may happen until you get this HPV 16, cancer-producing type, and it can go on to produce cancer. In HIV, especially HIV-positive MSM, this group all have HPV infection. So it's almost 100%. Okay? Even if people have not been sexually active recently, they still have HPV. So this is what we found in our studies. Everybody has it. How many people actually have the bad type of HPV? Well, you can see here that HPV 16, about 40% of HIV-positive gay men have HPV 16. So that's a bad situation. If your immune system is not perfect and you have this bad kind of HPV, you may well end up getting one of these HPV cancers. So what are the HPV cancers? They're listed here. So-called head and neck cancer, but it's really mouth and throat cancer. They call it head and neck cancer because it involves different parts of the head and the neck. But this is the fastest increasing cancer in the general population. And it's more common than cervical cancer. And it's HPV related. HPV and smoking. Penile cancer, HPV related, together with smoking. Cervical cancer, almost 100% is caused by HPV, and smoking is a cofactor. Vulvar cancer, same thing. And lastly, anal cancer. So anal cancer is caused by HPV 16 and some other types. together again with smoking. So what's the deal with the HPV vaccine? Well, if you get the vaccine early enough, too late for most of us, but you know, if you're in grade 6, 7, and you get HPV vaccine, it can help to prevent all of these cancers that I had listed there. And it may be 100% effective in doing that. We don't really know yet because it hasn't been around that long. But if you get the vaccine before you have an HPV infection, it's 100% effective. So it's pretty amazing. Is it of any use to most of us who already have HPV? We think so. We think there's still some benefit, but it's not that 100%. So it's a little debatable where, you know, people should get the vaccine if they're over age 40 or 50. But if you're sexually active, it probably still is worth it. In the vaccine, there's a bunch of HPV types. So there's HPV 6 and 11 that cause warts. So this can prevent warts. And then there's those baddies, the 16 and 18, that cause cancers. So the HPV vaccine can prevent those. And then there's some other types that are not so common that also cause cancer, and those are in the vaccine also. So it's a great idea that they're immunizing people in schools. At first they were just immunizing girls, which is like ridiculous, but now it's boys and girls in schools that are getting the vaccine. Okay, so let's talk about anal cancer and anal precancer. Stop there, okay? All right, so this is a picture of the rectum and the anus right beside the drummer. We're a drummer here. Who is this guy? He's probably somebody famous. Take a photo. See, if you get too close to some people like this, you can pick up HPV. So that's the rectum, that's the anus, and where the two of them come together, the rectum and the anus, is just in about 4 centimeters or so. That's where cancers occur. So it's where two different kinds of tissues come together, that's where the cancers occur. So when we look in, that's the area that we look at to see if there's a developing cancer. And the doctors can feel this with their finger. So you should be getting an anal examination, men and women, at least once a year. And as I said, the doctors can feel the bumps in there. There's really only two things that cause bumps inside. One is a wart, and the other is cancer. So not enough doctors do this on a yearly basis. So it's a very important test. Next, please. So if you do get HPV infection, what happens? Most of the time, nothing happens, okay? You have the virus, you don't know you have it, you don't get any bumps, you don't get warts, you don't get anything, and that's it. So, you know, as I said, like 100% of HIV positive NSM have HPV, and most of them don't have any consequences from it, so that's good. If it proceeds, it can go on to what we call low-grade lesions. So these low-grade lesions are not going to kill you. They're sort of like warts or equivalent of warts. Okay? That's low-grade, and that's not a big deal. But the low-grade ones can go on to high-grade. So we use this term high-grade lesions. These are pre-cancer changes. And you know, some of you may have had this. You might have had pre-cancer changes like on your skin. The skin doctor takes it off and they keep looking at it, make sure it doesn't develop into cancer. So kind of the same thing here. So these pre-cancer changes, not 100% of them are going to go on to cancer, but you know, it's kind of scary when you have it. You might have a 5 to 10% chance of the pre-cancer going on to cancer. So those areas, when the idea is we look in and we look for these pre-cancers, and if we find them, we try to remove them, okay? We burn them off to try to prevent cancer. Next. why are we doing this? It's because anal cancer is incredibly common in HIV positive gay men. It's more than 100 times more common than anal cancer in the general community. And anal cancer is not very common in the general community, but in HIV positive guys, it's very, very common. It's much more common than colorectal cancer. Right? It's much more common than cervical cancer and breast cancer. So this is really, as far as we're concerned, it's the commonest cancer seen in HIV, especially in the men. So you can see that it's 100-fold more common, what's shown here. And HIV positive men, not gay men, they still have increased risk. Okay? So straight men, HIV positive, still have increased risk of anal cancer. Same thing for HIV positive women. And even HIV negative guys who've been sexually active, multiple partners, they have an increased risk. So not as high. The highest risk is HIV positive MSM. So this is the group that we screen first because that's the biggest risk. Next. Okay. So the question is how to prevent anal cancer. Since it's so common, it should be an important thing to look at. There are a number of screening tests that can be done. And as I said, one easy screening test that your doctors should do is the digital anal exam. Okay? Checking with the finger. It's ordinarily not a painful test, not uncomfortable, maybe a touch embarrassing, but anyway, it's a very useful thing to do. If you're looking for the pre-cancer changes, you have to do something else, because you can't feel those with your finger. Okay? So the pre-cancer changes, we can do an anal pap test, a swab in the bum. You can look for HPV itself, but as I said, almost everybody has HPV, so that doesn't help too much. And you can do what we do, which is a kind of anoscopy called high-resolution anoscopy. It's a very detailed anoscopic exam, and we can see stuff in great detail. So there aren't many people doing that. There's only a few of us in Canada. So this is the pap test, which is just a swab up the backside and rub it around. And if it's very abnormal, then you have something inside for sure, okay? If it's slightly abnormal, we don't really know. It's not great for detecting precancers if it's just sort of slightly abnormal. But if it's very abnormal and it shows high grade on the pap test, then you have high grade inside, okay? So you need anoscopy. Next. As I said, the HPV detection is very popular in screening in women for cervical cancer. Now it's like going to be the ¡1 test in women to look for HPV. But in people who have a lot of HPV, as I said, like 100% of the guys have it, not a great test. So not very useful. Next. This is the useful test. As I said, it's the high resolution anoscopy, also called HRA. Next. Hey, there I am. Oh, back up again. There I am beside the machine. So this is the high-resolution anoscope. It's quite an expensive machine. It's the same machine that's used to look inside at the cervix in women. So it's kind of called a colposcope in women, but we call it an anoscope in men. Next. So there I am looking, if that's your bum, don't say anything. I noticed some people here that I've seen intimately, but from the backside. Yeah, the anoscope goes in and the main machine stays outside, okay? You'll be happy to know. Or not. So it's a very bright light and a magnifier, and we can see a lot. And you can see on the TV screen above my head, that's what we see. And you can see pre-cancer changes. And if we see those, then we can remove them. Next, please. So this is what it looks like inside, okay? Another couple of clicks and other stuff will come up here. So this is that area between the rectum and the anus. And that's where the cancers occur. So that's called the squamocolumnar junction. So the rectum is the pink inside, and the anus looks a little white because we use some staining. We use vinegar staining. It shows up the area very well. So this is where we look, and this is normal looking. So it's supposed to kind of look like the inside of your cheek, and that's it. Next. And then we add some other stains, like Lugol's iodine. So there's iodine, vinegar, and it shows us these different colors, and we can tell what's abnormal. Next. A couple more clips. Yeah. So once we see something abnormal, then we can take some biopsies. We can take some snips, and actually, it's in an area where you don't feel pain there, just some tugging. So it's not so bad, really. So sometimes we take like 5, 6, 7, 8 biopsies. Usually, it doesn't bother people that much. Okay, so if we find something abnormal, we can actually treat it and try to remove it. And usually, we burn off the tissue. Next. We use this machine, it's called electrocautery. So again, it doesn't really hurt, but we do freeze the area and we burn it off. Next. Okay, so you've heard about HPV, HPV-related diseases and cancers. So how do we prevent these things? There are some things that can be done. Next. Well, they're not so much fun, but anyway, you can be monogamous. You hope your partner is monogamous. You're not going to pick up bad HPV types. You might already have them though. Circumcision does help to prevent bad HPV and penile cancer. So people who are circumcised are less likely to have HPV on the penis. Condoms do work to prevent transmission of HPV. Only on the area that's covered by the condom. So, it covers your penis, but outside the penis and the scrotum and your groin, your backside, you can have HPV there, so you can still transmit it even if you have a condom on. Smoking is a risk. As I said, alcohol is a bit of a risk. Green tea, hopefully somebody's having green tea here. It is protective. And there's actually a green tea cream that is used for warts. And you put it on the warts, they disappear about half the time anyway. So green tea works against HPV. Cruciferous vegetables, we had some of those tonight too. This is the healthiest place. Cauliflower, broccoli, Brussels sprouts have anti-HPV function, and they're antioxidants. So those are good. The HPV vaccine might be of some benefit in older ages beyond the school kids, but certainly it is working for the school kids. If somebody has a pre-cancer change and we remove that pre-cancer and we give them the vaccine, it helps to prevent the pre-cancer from coming back. So it may work even if people already have HPV and some HPV changes. Next, please. So, so the HPV vaccine, as I said, mainly for boys and girls. It's publicly funded for boys and girls in most areas in Canada. For people with HIV, it is covered up to age 26, only because that's where the studies have been done. So Ontario covers it up to that age. And as I said, it might be useful even if you have been infected with HPV and you have these pre-cancer changes. Okay, next. So, in summary, cancer is the #1 cause of death in HPV now. And anal cancer is the #1 cancer. So you should all be aware of it. And often when we do screening in our clinic, I ask some of the people, do they know anybody who's had anal cancer? I tell you, about half the guys know somebody who's had anal cancer. And, it's not so pleasant. So it's good to prevent. So the HPV vaccine may prevent the consequences of HPV and various HPV cancers. And then lastly, you can have some screening with digital anal exam, or in a specialized clinic like ours, we do the anal pap test, the HRA, and sometimes HPV testing. So that's all I have to say. And we do have actually some informative brochures. Do you have an example there? If you want to take one, feel free. We have a pile here. It just talks about HPV, anal cancer, and gay men. Thank you very much.
What causes testicular cancer?
It's not a virus.
Is that a virus?
No.
Okay.
Testicular cancer is not increased in HIV. Usually occurs in young guys, between 20 and 40. So, happily, it often can be cured by removing one of the testes.
If you got anal cancer, you can feel something different,
Yes.
like a third or something.
If you have anal cancer present, well, you're not going to feel much different overall. You might have some pain, some bleeding, and you can feel it yourself with your finger. The problem is, you see, when we screen for anal precancers, as I said, they're very small. You can't really feel them with your finger, and that's the time to find it. The people that come in who already have anal cancer, it's very advanced, and usually they have to have chemotherapy and radiation or some more severe surgery. So it's better to get it before it comes to that. Yes?
Do people actually die from anal cancer?
Yes. So if you do have anal cancer, the mortality rate, the death rate is about 50%. So over a period of 5 years, about half the people will die. That's with treatment. So pre-cancer's mortality rate is 0. Yeah.
So you talk about is in like different stages, right?
Yes.
So say it's in stage, maybe stage 2. Okay, so how often would it jump to another like worse stage,
Yeah.
or if it stays in that stage
Yeah,
for
so-
whatever long?
Now, these are very good questions that we don't have the answer to. I think, yeah, so you're asking about sort of low grade moving to high grade, and then maybe moving to cancer. So we don't actually know these numbers. Most people will have the early stages, like low grade. Most of them, nothing happens to them. Okay? But people who have high grade, those are the ones that have a higher risk of going on to cancer. And we think it's about 5% of those people to 10% over a period of 5 to 10 years will go on to cancer. Something like that. Yes?
Are there any role of antivirals in preventing the transmission of HPV?
Yeah, so the question is, are there antivirals that will help prevent transmission of HPV? Not really. HPV, we don't have any good antivirals for HPV itself. And unfortunately, the antiretrovirals don't seem to be doing much, because anal cancer is still increasing, and people are on antiretrovirals. They're doing great otherwise, right? 90% of people have undetectable viral load. Most people have CD4 counts like over 400. But despite that, anal cancer is still increasing. So either it was some seeds that were planted years ago that caused the cancer, or there's some other reason. Maybe people are just living long enough that they're able to get the cancer.
So one last one.
Yeah.
You did mention briefly colorectal cancer. A lot of people get colon cancer mixed up with anal cancer.
Right.
Can you just do a little bit more about that?
So that's a very good point. Colon cancer or colorectal cancer is totally different from anal cancer. So people often want to know, they say, well, I've had a colonoscopy to look for colon cancer. Did they also screen me for anal cancer? They kind of look, but, and sometimes they do find something, but it's not the best test for looking for anal cancer. So having a colonoscopy, that's a screening test for colon cancer. Or if you collect some stool on these little pads and you mail them in, that's another way of doing it. So there are some screening tests for colon cancer. So colon cancer occurs usually in older people, more common in men. The rates are about 50 per 100,000, and it's not a virus, okay? So this is not HPV. Anal cancer occurs at a rate of about 1 per 100,000 in the general population, or 100 per 100,000 in HIV positive MSM. So they are totally different. Again, the anal cancer is just in that portion of the anus, which is about 4 centimeters in, and colorectal cancer is all the way up.
But the people who get the vaccine, the HPV vaccine, are they protected 100%?
Yeah, we think that people who have gotten the HPV vaccine, it looks like in the studies, it's 100% protective, okay? So as far as cervical cancer and cervical changes from HPV, after getting the vaccine, it looks like it's down to almost 0. Who knows what's going to happen though over 15, 20 years? It may not be the same. So it may be the same thing for anal cancer, that there may be complete prevention of anal cancer. That's if you get it, you know, when you're a kid, the vaccine. Yes?
May I ask you, I understand that HPV test is not covered by OHIM.
Right.
So if it's referred, if you have requisition from HIV clinic, is it will be covered?
We do HPV testing as part of studies. So in our studies, we do HPV testing. But as I said, it's not really all that useful. What's going to be coming though, and they do this in the States, is screening women for cervical cancer by doing HPV testing. So it will be more widely available. They haven't accepted this yet in Ontario.
So now if you were to want to have your HPV vaccine, you have to ask the doctor for it.
Yes. So how can you get the HPV vaccine? Well, number one, you pay a few $100s. It's pretty expensive. It's about $120 a shot, and there's 3 shots. So that's quite expensive. If you have insurance, your insurance will pay for it. If you're under age 26, it's covered by Ontario government. So those are the ways. Is it worth it? You know, it makes it a tough decision. If you're a 50-year-old guy who doesn't have any problems in the anus as far as pre-cancer changes that you know of, is it worth spending $350 to get this vaccine? Kind of uncertain. If you have some pre-cancer changes that have been removed, it's worth it.
Do you know that if someone is prone to hemorrhoid,
Yes.
hemorrhoid turn into
No. Hemorrhoids don't turn into anything cancerous. So some of the things that seem like they're scary to people are various bumps. Some of the bumps are hemorrhoids. You know, not pleasant to have, but no problem as far as killing you. That's number one. Warts. Nobody likes to have warts, but warts don't kill you. They're just kind of unpleasant. And skin tags. So a lot of people have skin tags. Some people want to have them removed. Nobody wants to remove them. But they're a kind of hemorrhoid. They're sort of external hemorrhoids. And generally, those are no problem. So what are the warning signs? Okay? You can have these lumps and bumps. If you have a very painful area, especially a painful lump, and there's some bleeding, that's all bad or potentially bad. So go and get it checked out. It may just be a wart, it may be hemorrhoids and a fissure or something like that, but get it checked out. Yeah.
If you have, let's say, concurrent HSV,
Yeah.
are you at an increased risk of acquiring HPV or anal cancer if you have them?
Okay, so the question is, if you have herpes, does that cause any further problems as far as HPV? Or, well, one thing is, if you don't have HIV, herpes can be a risk factor for picking up HIV, okay? Because it sort of damages the mucosa and stuff like that. As far as herpes and HPV, they don't really do much to each other. They're sort of fighting it out for prime time.
Is it necessary to take the HPV testing before the vaccine?
Yeah, so the question is, should you get HPV test before getting the vaccine? First of all, it's hard to get the HPV test, number one. And number two, it's not really worth doing it because we know you're not going to have all the types that are present in the vaccine anyway. So the vaccine will still help you. And even if you have maybe a bad type of HPV, usually your immune system can get jazzed up by the vaccine and it might help. So yeah, don't get tested beforehand. We know what it's going to show anyway.
So does the HPV test tell you what type of HPV?
Yeah, so there are different kinds of HPV tests. The one that's more easily available is a test that tells you if you have any HPV at all, or it'll tell you if you have a cancer-producing type of HPV or a non-cancer producing type of HPV. That's the easiest test to get. We do that in the hospital quite easily. It's called hybrid capture. Okay, so you can get that information. There are other tests that will tell you exactly which type you have. Those are not so easily available, those tests. So we do it in our studies, we send it to Winnipeg, and they come back and they tell us, you know, this guy has HPV 6, 11, 16, 18, 53, and 31. Okay, so what are you going to do with that information? Nothing too much. Because in 6 months, you may not even have those same types. You may have different types. So it's not really that useful. But a lot of people are very curious. Huh? It's like sending off for your DNA testing. You know? Everybody's sending off for their DNA testing. Like, what the hell is that going to tell you? You know? Same thing here. Doesn't help them.
Question.
Yeah.
So in your slide you mentioned men and other, right? It's 44 increase.
Yeah.
Right? So are those like NSM or no?
Yes. Okay. No. Well, there's two categories. So one is just HIV positive men in let's say HIV clinic. They're not gay men. They're straight men. They have increased risk for anal cancer. HIV negative gay men also have an increased risk. The highest risk though is HIV positive and MSM together.
Okay, so for the non-gay men,
Yeah.
how do they get infected?
Okay, so this is a very good question. How do people get anal cancer if they're not having anal intercourse all the time? We don't 100% know, but I can tell you that who do you think in the general population gets anal cancer more, men or women? The answer is women. In almost all studies, it's women, number one, in the anal cancer category. The HPV kind of likes being in the anal canal even more than in the cervix. So women might have HPV in the cervix, like 10% of women might have a bad kind of HPV in the cervix, but about 40% will have it in the anal canal. Have all of them had anal intercourse? Probably not. So it kind of moves around in the genital, anogenital area, and it can get into any hole it finds. and it likes the anus. So yes, a good question. There's some people, those are some of the groups that don't have high rates of anal intercourse. Women, especially HIV positive women, and HIV positive straight men. That's it. Thank you very much.
Thank you.